As a new parent, it can be overwhelming to see your baby getting all these vaccines, but I just want to reassure you that pediatricians are using an immunization schedule that is based on research and science behind it.
So I think it's important for parents to kind of break them down and really realize what their children are getting. The very first shot that children get is hepatitis B, which is going to prevent hepatitis, which is inflammation of the liver, which can lead to liver failure, cirrhosis, and long-term disease in adulthood.
Typically, Hep B is given at birth, at 1 to 2 months of age, and then again, the third dose at 6 months of age.
At the 2, 4, and 6-month visit, your child should also be getting an inactivated polio vaccine and rotavirus vaccine. Now, polio is one of the great marvels in the vaccine world. Polio is a virus that can cause, it can cause paralysis. We all remember President Roosevelt in the wheelchair from polio. Now, rotavirus causes diarrhea, simply put. We see a lot of it in daycares. We see a lot of it in areas when children are close together and they don't wash their hands. Another 2 shots that parents will see in their 2, 4, and 6 month would be Hib and PCV. That stands for Haemophilus influenza and pneumococcus. Now, Haemophilus, my pediatric mentors tell me stories about Haemophilus in the early 90s and 80s causing meningitis and death in numerous children. I've never seen a case now, thanks to that vaccine. Pneumococcus is also a cause of bacteremia, meaning bacteria in your blood, can also cause pneumonia, can also cause meningitis. DTaP, we throw that acronym around all the time, stands for diphtheria, tetanus, and pertussis. So diphtheria is a bacteria that can be life-threatening, and we used to see a lot of it back before the vaccine era. Tetanus, a lot of people think of lockjaw and muscle paralysis. And then pertussis may not sound familiar, but when I say whooping cough, everyone knows what that is. And whooping cough can be life-threatening in young children or elderly or the immunocompromised.
So you get the DTaP vaccine at 2 months, 4 months, 6 months, and between 15 to 18 months. Flu vaccine prevents against influenza, which is a type of virus that can cause body aches, muscle aches. It really can knock you out. And all babies 6 months and older get the flu vaccine. The first time they get the flu vaccine, they'll need 2 doses. And then after that, annually, it'll only be 1 dose a year.
At 12 to 15 months of age, there's another very important set of vaccines that your child needs. MMR, which is a combined of mumps, measles, and rubella, and varicella, which is a fancy name for saying chickenpox. Now, mumps, measles, and rubella, all individually can be life-threatening. I know when we were kids, we all had chickenpox and it wasn't a big deal, but what people don't realize is that before the varicella shot, chickenpox is actually a large cause of meningitis, inflammation of your brain. Why take the risk? There's another hepatitis shot your child needs, that's hepatitis A. Now, hepatitis A, your child is eligible to get the vaccine at age 12 months and a little bit older to finish the series.
Many of these vaccines are going to need booster doses as your child gets older. And the reason that booster doses are so important is because research has shown sometimes the immunity wanes.
The amount of foreign antigens a child sees at the park or at daycare is far greater than the amount they see in their childhood vaccines.